Hey everyone, today we're going to start chapter 9, which is on wounds. Hopefully you've looked over chapter 8 video, which is on bleeding. But today we'll start with wounds, and I'm sure you all have had one or helped treat one on somebody. But a wound is any kind of break in the skin surface. May or may not bleed, it usually does. But again, anytime you have an open wound or a break in the skin, there's a possibility for bacteria to enter. Different types of wounds. So you've probably had some of these as well, maybe just didn't realize the name or the distinction in each. An abrasion is your typical scraped knee or kind of road rash, rug burn. Just the top layer of skin is removed. May or may not bleed. If it bleeds, it generally doesn't bleed very much. Laceration and an incision are similar, except that an incision is more smooth edges, more of a straight line like a surgical incision, versus a laceration, which is generally more jagged, irregular shaped kind of cut. They both can be long, they both can be deep, they may or may not need sutures, which we'll talk about in a little bit. Puncture is usually deep, usually narrow. Think of getting stabbed with a pencil or a bite from a dog or something like that, a snake bite. It's usually a puncture. Deep, narrow, can go through all the different layers of skin. Again, higher risk of infection. An avulsion is when a piece of skin is torn loose and is hanging or might be completely torn away. So in the picture you see there, that person's ear has a piece of their external ear avulsed. Again, depending on where it is on the body and how vascular it is, you may see a lot of bleeding with that. And then an amputation is when a body part is cut or torn completely off. So what do we do? Again, you always start by protecting yourself. If you have gloves, that would be great. Again, you're dealing with blood, so the potential for infection and disease. You'll want to expose the wound, control the bleeding, direct pressure, elevation if you need to. Again, you can wash with soap and water. We wouldn't want to scrub because if they already have a wound, we wouldn't want to do anything else that's going to damage the tissue around it. When you're cleaning out a wound, regular tap water is just fine as long as it is turned on at a high enough pressure to irrigate or wash out the wound. It doesn't have to be bottled water, it doesn't have to be sterile water. They've done studies and they found tap water to be just as safe as any other water, less expensive, readily available. Again, you just have to have it forceful enough that it can actually flush out any kind of dirt or debris that's in there. So for wound healing, shallow wounds, again, you can wash them with soap and water, flush them clean. We wouldn't want to use any of the things you see listed there, alcohol, iodine, hydrogen peroxide. I know sometimes used to pour hydrogen peroxide in wounds because they thought it cleaned it out better. But really what it does is just injure and damage the tissue even more. Soap and water works just as well as anything else. Things that have a really high risk of infection that you probably wouldn't want to attempt cleaning out yourself because you could do more harm and it's much harder to clean them out. Bite wounds, again, especially from a person, a dog or a cat, any kind of puncture because it's too deep and they're probably going to need something special to irrigate that out. Crushed, jagged wounds, wounds that are really too large that you're just not going to be able to clean out well enough. Leave that to the hospital to do that. Again, if you need to remove small objects, you can do so with the tweezers. If you have several splinters, little stones, stepping on glass, anything like that. Don't be surprised if it stopped bleeding and you kind of wash it out and clean it out and it starts to bleed again. That is normal, but again, just direct pressure to try to stop the bleed again. So how do you know when to seek medical care? For a high-risk wound, again, a lot of what we talked about, the fight bites. We said the human mouth is dirtier than anything else. Wounds that don't come together very well, real jagged, skin torn away, amputations, things like that. When a wound is deep enough that it's not going to close on its own. Stitches generally are best placed within 6 to 8 hours after an injury. So you're really not able to decide the next day whether or not you want to go to the hospital. At that point, it gets to be too late and they may not be able to suture it. I wouldn't apply antibiotic ointment to anybody. Some people can have reactions to Neosporin and things like that. So if you don't know them, I probably wouldn't put that on somebody. Or if the victim hasn't had a tetanus shot. Usually tetanus is good for about 10 years. But if you have an injury, usually after 5 or so, they'll want to give you another one. Tetanus is a bacteria. So we often hear about tetanus, but not a lot of people actually know what it is. But it is a bacteria that can enter a wound from an animal usually, or a nail, or something that's rusted out or has this bacteria on it. And this bacteria can travel to the brain and spinal cord, which can cause significant, severe, uncontrollable muscle spasms. It can be treated if it's caught early, but it is really hard to treat. A lot of people have long-term consequences from it. There is no known antidote to the tetanus toxin once it enters your nervous system. So the easiest, best, most effective way is to make sure your tetanus shot, your booster shots are up to date. Difference between a dressing and a bandage. A dressing is what you put over a wound to control the bleeding and prevent, dust, debris, bacteria from entering. A bandage holds the dressing in place, and we'll practice using dressings and bandages during our bleeding and wounds lab. So again, I think we mentioned this before. If a dressing becomes blood-soaked, we don't want to take it off. We just keep adding new layers to it and just keep bandaging around. If a dressing is stuck, we're not going to try to rip that off. Again, it's going to take off the scab or any kind of healing tissue with it. Just new ones on top. If you have to remove a stuck bandage, soak it in warm water and try and peel it back off gently. Signs of infection. Any kind of swelling, redness, warmth, pain, discharge that wasn't there before. If there's a fever, if their redness and the streaks start to extend from the wound up an extremity, any kind of swollen lymph nodes. Generally, if a person is getting worse instead of better. You can see the wound that's there. It's a fairly sizable wound. Looks like towards the top right of the wound, you see that little bubble or blister. That may be draining fluid. You can see how red it is around it. And then extending from his palm up towards his forearm, you can see that it starts to have some red streaks. And that's a sign that the infection is moving from that place and is going into the bloodstream. So again, you definitely would want to get it looked at. Probably antibiotics at this point would be appropriate. Antibiotic ointment, again, only if you know the person and you know they're not allergic to it. Warm soaks might help kind of get a lot of that pus, which is really dead cells, and drain that. Changing the dressings, keeping them clean. And again, doctor if you need to, it starts to become worse. Amputations. Here's a good picture. There's lots of different types of amputations. The good news is that oftentimes, 80 to 90% of the times, a limb or an extremity can be reattached, depending on the type of amputation. So the first one is a guillotine. This is just what you think of as an amputation, just a clean cut, complete, detached limb from the body. These have the best chance of reattachment. Crushing injuries have the worst chance of reattachment, and it kind of makes sense that you're crushed. That means everything underneath is crushed, not just your skin, the blood vessels, the nerves, the bones, everything is crushed. It's much harder to reattach. And then the next one is a degloving, which is the picture that you see there. It's someone's thumb, and you can just make out that the fingernail is still there, but the skin has basically been peeled off. That's called a degloving type of amputation. And remember what we said, when you have a complete clean-cut amputation, the bleeding may not be as severe because one of our body's defense mechanisms is for those blood vessels to kind of constrict and pull in on of themselves, and when they do that, it tends to slow the bleeding. So you definitely would want to try to recover the amputated part. Okay, they can't reattach it if they don't have it. So you'd want to handle it carefully. Try not to damage that part anymore. Do not attempt to clean it. You'll just end up damaging the tissue, and then they won't be able to reattach it. Treat the victim for shock, which is what we'll learn in our next chapter. And what you'll do is when you have that amputated part, you want to wrap it in gauze, place it in a bag, and keep the bag cool. We don't want to freeze it because we don't want to give the amputated extremity any kind of frost nip or frostbite. And then make sure the part goes to the victim to get medical care. So here you see, wrap a part in a dry, sterile gauze. Sterile would be best. Dry is good. If you wrapped it in a wet gauze, if you think of it when you are taking a shower or you're in a bath or in the pool too long, what happens to your skin if it stays wet for a long period of time? It gets real wrinkly and it kind of changes texture, and that moisture is not good for trying to save an amputated part. So you'd wrap it in dry gauze, place the gauze in a plastic bag or a plastic container, and then place that container on a bed of ice. So it'll be cold, but it won't be frozen. You don't need to bury it. You don't need to do anything else with it. Just kind of keep it on a bed of ice to keep it cool. Blisters, we've all had them, and I think you probably know by now not to pop a blister, that the fluid that forms inside a blister is sterile. So as soon as you pop it or as soon as it breaks open, there's an opportunity for infection. So care for blisters is, again, you can clean it with soap and water, but whatever's inside is sterile. It shouldn't get infected. Any kind of cushion that you can think of to keep that blister from rubbing against, a shoe, a sock, pants, whatever it was that caused the blister in the first place. Antibiotic ointment, again, really isn't necessary unless it's broken open. Care for embedded objects or impaled objects. So this is something you may not see as much. If you do, it's more likely to be with like fish hooks or something like that, as opposed to having someone with a screwdriver or a steel rod impaled in them. First and foremost, you got to stabilize the object. Okay, if it went into somebody's body, the last thing we want is it moving around and doing any more damage than it may have already done. So we got to stabilize the object. We're not going to try and remove the object because we don't know what structures are around it or if we're going to hit them on our way up. The only time you'd consider removing an object is if it was obstructing the airway and you are too far from medical help. So best thing you can do is stabilize it, control the bleeding around it, kind of wrap dressing around the object as best you can, kind of big bulky dressing, and take the person to the emergency room. If the object is impaled in the eye, just like anything else, we don't want to put pressure on it. You want to stabilize the object, and really important here is we need to cover the uninjured eye. Because if you think about it, your eyes move together. And if one eye is injured and you don't cover the other eye, when your good eye moves, your injured eye will also try to move with it. So you need to cover both eyes to prevent further injury. But remember, somebody has an impaled object in their eye, and if that isn't cause for anxiety enough, when you cover both of their eyes, it would become very frightening. So always explain to the person what you're doing. Tell them what you're doing. Keep talking to them so they know that you're nearby. Closed wounds are wounds where the skin is not broken and there's no external bleeding. You may have tissue damage and you may have internal bleeding, but no external bleeding. This is your typical bruise, your black and blue. A hematoma is more of a collection of blood or a blood clot that is under the skin. Usually forms a lump, but it stays fairly well contained. Unlike a bruise that kind of is more superficial and spreads out, hematomas are almost feel more like a cyst inside, but they stay generally contained in there. Best thing you can do for them are ice. Remember, ice is going to help with pain. It's going to cause blood vessels to constrict, which is going to help to control the bleeding. Again, think about what it was that caused the hematoma. So you'll want to look for fractures. You'll want to look for other signs of injury. We'll practice how to splint fractures later in the semester. And then again, depending on the injury, you may need additional medical care. Wounds that require attention. Anytime you can't get bleeding to stop would require extra attention. Wounds that are really deep and would require suturing or more thorough cleaning. Embedded objects, foreign matter that you can't get out of a wound, any kind of bite. You can certainly read them that are here. basically, if in your mind it's telling you they probably need help, they probably do. And again, always look for signs of shock because with a lot of these injuries, something significant happened, and once shock occurs, you cannot reverse it. So the best thing we can do for shock is prevent it. And then lastly, we'll finish with gunshot wounds. Again, you probably won't see it, but since half of all homes have a firearm, you may. And I kind of have written for you how a bullet will cause injury. Not only does the bullet cause injury when it enters, in this case, the person's wrist, so it's going to crush tissue and go through bone and maybe sever, arteries and nerves, but also that the shock wave that occurs is that it doesn't just affect the tissue it physically hits. Those shock waves can extend tissue damage beyond the actual wound. How you care for it is pretty much the same as you care for anything. Direct pressure, try and control the bleeding, look for an entrance and an exit wound, apply dressings, get a bandage, watch for shock, try to keep the victim calm, make sure they don't have any other life-threatening injuries, and seek medical care.